Hello, my name is David Rakel. I'm the director of the Integrative Medicine Program, and this video is on the internal or the emotional aspects of pain. So I'm accompanied again by Amy Bauman, our third-year resident osteopathic doc, who actually has a specific interest in this mind-body phenomena. Actually, we shouldn't even call it a phenomena.
Right.
It's a real evidence-based process. It is. We shouldn't even call it mind-body because there is no mind and body. It's one process. And when you're trying to convince patients of that, Amy, how do you word that? I mean, how do you get them out of the perception that, oh, this doctor thinks it's all in my head?
Right. So this is a really hard thing to do, I've found. You run the risk of offending someone and having them not listen to you. But I think one way to start is just to ask them where they carry their stress. And a lot of people can relate to that.
Yeah.
Most everyone will be able to answer you.
Yeah. I carry mine in my neck.
Yes, and I carry mine in my low back.
Perfect.
So there you go.
What a great teacher.
Right.
So, we can learn from that.
Right. And I think if you can get people identifying with how their stress and their tension is affecting their pain, then you can start having a conversation and kind of growing on that theme.
Yeah, nice. So I use that as, I say, well, sometimes my neck hurts when I sleep on it wrong, but sometimes it hurts when I'm stressed or I'm holding tension. And just like that mind-body can cause a symptom, the mind-body can heal a symptom. And then it empowers the patient to realize that, boy, this is a strong connection.
Right.
I can use this to my benefit.
Right.
Yeah.
And I think the piece, the point that you made about empowering the patient is so important. Oftentimes, the things that we do for back pain are, the practitioner giving a prescription or telling a patient this is what they need to do. And oftentimes, it's so much more effective if the patient is empowered to make the changes themselves.
Yeah. So one of my favorite quotes is by William Boyd. He was a pathologist at the turn of the century, and he said, "The sorrow that hath no vent in tears may make other organs weep." And we all see this day in and day out in primary care.
We do.
But it's hard to address that in a 10-minute visit.
Right, right. That is the challenge.
But we can. We can over time, even if it's a 10-minute visit every week.
Right.
And that's the beauty of primary care. The NICE guidelines supported psychology and cognitive behavioral therapy as a very important ingredient in treating low back pain. Part of that is this emotional awareness piece.
Right.
And the emotional awareness, some people call it mind-body syndrome. John Sarno called it tension myositis syndrome, where this emotional stress causes constriction or stimulates the sympathetic nervous system, reduces blood supply to the muscles, exacerbates pain.
Right.
That can be a very effective tool to bring into the patient's consciousness.
Right.
What are some tools, some resources that you found to be helpful in helping patients realize the importance of this?
Right. So John Sarno's book is actually one that's really great, Healing Back Pain. Howard Schubner has done some work and has a website, unlearnyourpain.com.
These resources are all in the module.
Yes, they are all in the module. And both really emphasize this idea that stress and emotions play an important role in our pain. So those are two places to begin. Also, journaling is another great way for patients to explore their pain and their emotions and better understand how they are interconnected.
Yeah, and this is something that we can do.
Right.
We don't need to bring another cook into the kitchen, as we might say.
Right.
We can encourage the patients just to write about the stressors in their life.
Right.
And that alone provides an avenue to give that stress a voice.
Right.
So it doesn't have to internalize and exacerbate the pain.
Right. And the great thing about the module is that it allows the practitioner to sort of introduce the idea to the patient, talk to them a little bit about this, and then patients can go home and work on it in their free time, come back, touch base, see sort of what came of this and how things are going.
And we don't need to read it.
No, not at all. No one does.
Right. The therapeutic process comes in their catharsis, or cussing on paper, I like to say.
Right.
I always like to encourage them to always, because they're usually writing about something stressful, but we all learn from our stressful events, and I always want them to end with something positive, what they may have learned from that challenging process.
Right.
But that's something we can do as their primary care doc.
Right. Yeah, and those are great ways to kind of get people thinking about their emotions. Another thing that they can do is meditation, mindfulness-based stress reduction. Again, we talk about this in the module, but this is a way for people to really become more aware of their feelings in the moment. It sort of forces people to address and think about the pain. And in effect, it reduces the fear that people have about their pain.
The Catherine Bonus, who heads up our mindfulness program here at the University of Wisconsin, has a good example of us trying to ignore our emotions, ignore our stress. So imagine me running around trying to escape you, which is the stress trying to grab me. And I keep running, and I never really solve the problem. We don't solve the problem until we pause, we stop, and we turn towards it, which no one wants to do. No one wants to turn towards their suffering. But that's where the healing occurs, if we do that in a way that's supported by the interdisciplinary team found in the patient-centered medical home. We often hear what's the difference between mindfulness and another technique like cognitive behavioral therapy.
Yeah, this is an interesting question, and it took me some time to kind of figure out the difference in thinking about this. But mindfulness really forces, or mindfulness is about being present and in the now, you know, and being aware of what's going on inside your body and
without judgment.
Without judgment, right? Whereas a lot of psychotherapy techniques are about, you know, analyzing what's going on,
learning from events.
Learning from events, exactly. And then the emotional awareness is really about understanding your emotions and how they affect you.
So 3 very effective techniques. Another reason that we can try and match the therapy to the patient's own belief, own resonance with therapy that hopefully will be most effective for them. But probably the most neglected piece in treating pain. Because no one wants to do it.
And I think we're often scared to bring it up with patients, and it's interesting because a lot of the time when you actually do, they're open to it and they're happy to talk about it.
Oh, and it's so rewarding. When you do touch the authentic need of what's at the root of some pain syndromes. Not the whole bag of worms, but a very important piece of the 3-legged stool. Thanks, Amy.
Thank you.